During venipuncture, what is the most critical factor in ensuring accurate patient identification? A. Asking the patient's full name only. B. Verifying the patient's name and date of birth with the wristband and requisition form. C. Calling out the patient's name in the waiting room. D. Asking the patient to spell their first name. Answer: B. Proper identification requires matching both the name and date of birth on the requisition form with the patient's wristband. This avoids critical errors, especially in hospitalized or unconscious patients. A phlebotomist must collect a specimen for a fasting glucose test, but the patient admits to drinking coffee with sugar. What should the phlebotomist do? A. Draw the specimen immediately. B. Proceed and note it on the form. C. Inform the nurse or provider and reschedule the draw. D. Ask the patient to rinse their mouth and then draw. Answer: A. Although it's a concern, the phlebotomist should draw the sample as ordered and notify the lab about the fasting violation. The provider will decide whether to accept or reject the results. Which of the following tubes must be filled to the correct volume to maintain a 9:1 ratio of blood to anticoagulant? A. Red. B. Lavender. C. Light blue. D. Green. Answer: C. Light blue tubes contain sodium citrate, and an incorrect fill volume will distort coagulation test results by altering the anticoagulant to blood ratio. What is the best action to take if a patient refuses a blood draw? A. Persuade them to comply. B. Notify the provider or nurse and document the refusal. C. Walk away and skip the test. D. Tell them it's mandatory and proceed. Answer: B. Patient refusal must be respected. The refusal should be reported and documented immediately, allowing the healthcare provider to follow up. What is a potential complication if the basilic vein is used improperly? A. Patient fainting. B. Hemoconcentration. C. Puncture of the brachial artery or median nerve. D. Sample clotting. Answer: C. The basilic vein lies close to the brachial artery and median nerve, increasing the risk of serious injury if used carelessly for venipuncture. When collecting blood cultures, what is the most important step to prevent contamination? A. Using gloves. B. Labeling bottles properly. C. Scrubbing the skin with chlorhexidine. D. Using a large needle gauge. Answer: C. Skin antisepsis is crucial. Blood cultures must be collected aseptically, and proper use of chlorhexidine or iodine reduces false positive contamination. What could be the consequence of drawing a potassium sample from a site with vigorous fist clenching? A. Increased glucose. B. Hemoconcentration leading to false high potassium. C. Increased platelets. D. Decreased calcium. Answer: B. Fist pumping causes hemoconcentration and potassium leakage from cells, resulting in falsely elevated potassium levels. In which scenario should a dermal puncture not be used? A. Patient has severe burns. B. Venous access is difficult. C. Neonate needs a bilirubin test. D. Coagulation studies are ordered. Answer: D. Dermal punctures are not suitable for coagulation studies because capillary blood does not provide accurate results for these tests. Why is it important to avoid probing during venipuncture? A. It increases blood flow. B. It improves visibility of the vein. C. It increases the risk of nerve damage and patient pain. D. It helps access deep veins. Answer: C. Probing is dangerous and unprofessional, risking damage to surrounding tissues, including nerves, and causing unnecessary trauma. When should a blood specimen be labeled? A. After leaving the patient's room. B. Before the draw begins. C. Immediately after collection, in presence of the patient. D. During sample transport. Answer: C. Labeling must occur immediately at the bedside, in the presence of the patient, to ensure correct patient specimen match and prevent misidentification. What action must be taken when a hematoma forms during a venipuncture? A. Elevate and apply firm pressure. B. Continue drawing slowly. C. Remove tourniquet only. D. Use a smaller needle. Answer A. Once a hematoma is observed, stop the procedure, apply pressure, and elevate the arm to minimize swelling and internal bleeding. Which additive is used in a green top tube? A. Sodium citrate. B. EDTA. C. Heparin. D. None. Answer C. Green top tubes contain heparin, used for plasma separation and chemistry tests requiring whole blood without clotting. Which laboratory test is highly sensitive to hemolysis and should be handled with extra care? A. Hemoglobin. B. CBC. C. Potassium. D. Glucose. Answer C. Hemolysis causes potassium to leak from red cells into plasma, leading to falsely elevated potassium levels. What must be done if a patient lacks an ID band upon arrival for inpatient phlebotomy? A. Proceed and ask the nurse to confirm. B. Write the patient's name on a label. C. Ask the patient to confirm details only. D. Do not draw until proper ID is applied. Answer D. According to hospital protocol, no blood draw should be performed without a valid ID band to ensure correct patient identification. Which of the following specimens must be protected from light? A. Blood cultures. B. Lactic acid. C. Bilirubin. D. Creatinine. Answer C. Bilirubin degrades in light, so it must be protected by wrapping the tube in foil or using an amber-colored tube. How long should pressure be applied after venipuncture in a patient taking anticoagulants? A. 2 to 3 minutes. B. 30 seconds. C. 5 to 10 minutes. D. No pressure is necessary. Answer C. Patients on anticoagulants have delayed clotting. Prolonged pressure prevents hematoma and prolonged bleeding. What is the reason behind discarding the first drop of blood in a capillary puncture? A. It contains excess WBCs. B. It contains tissue fluid that may dilute the sample. C. It increases RBC count. D. It removes air bubbles. Answer B. The first drop often contains interstitial fluid and should be wiped away to ensure accurate sample concentration. What color top tube is used for an ESR test? A. Light blue. B. Red. C. Lavender. D. Green. Answer C. ESR, erythrocyte sedimentation rate, requires whole blood in EDTA, lavender, tube to prevent clotting. Which of the following is the best practice when drawing blood from an forearm? A. Draw above the fore. B. Draw from the fore line directly. C. Use the opposite arm if possible. D. Draw immediately after fore flush. Answer C. Blood should always be collected from the opposite arm if possible, to avoid contamination or dilution from fore fluids. What is the appropriate needle gauge for standard adult venipuncture? A. 18. B. 21 to 22. C. 27. D. 14. Answer B. A 21 to 22 gauge needle is the standard for adult venipuncture, balancing flow and minimizing hemolysis. How should a specimen for lactic acid be handled after collection? A. Frozen immediately. B. Transported at room temperature. C. Kept warm in an incubator. D. Chilled and transported on ice. Answer D. Lactic acid degrades at room temperature. It should be chilled immediately to preserve stability. Which tube should be collected first in a venipuncture draw? A. Lavender. B. Green. C. Blood cultures. D. Gray. Answer C. Blood cultures are collected first to maintain sterility and avoid contamination from additives in other tubes. What is the function of the additive in the gray top tube? A. Clot promotion. B. Glucose preservation. C. Coagulation inhibition for PT. D. Bacterial inhibition. Answer, B. Gray top tubes contain sodium fluoride and potassium oxalate to prevent glycolysis, preserving glucose levels for testing. What is the maximum number of venipuncture attempts recommended per phlebotomist? A. Unlimited. B. 2. C. 4. D. 1. Answer, B. Best practice recommends a maximum of 2 attempts per phlebotomist to reduce trauma and allow escalation to a more experienced provider. Which infection control practice must be used before every venipuncture? A. Double gloving. B. Cleaning with saline. C. Hand hygiene and glove use. D. Face mask application. Answer, C. Proper hand hygiene and glove use are standard universal precautions to prevent transmission of infections.